This will be a wrap-up video on PAD, or peripheral arterial disease, venous insufficiency, Raynaud's disease, and DVT. Peripheral vascular disease is actually an umbrella term for peripheral arterial disease, which deals with the arteries, and venous insufficiency, which deals with the veins. Raynaud's disease also falls in that category as it affects the feet and the hands and constriction of the blood vessels, which we will talk about. I drew a picture of a body here, and if you can see and remember that you have your heart and your arteries push blood down to your feet and the veins bring blood back up. So when we're dealing with arterial disease, it's actually difficulty getting the blood down to your feet for a variety of reasons, most common cause being atherosclerosis or plaque buildup in the arteries. The veins have other reasons why we have vein issues. One of the reasons could be DVT, or blood clots in the legs. So first let's talk about peripheral arterial disease, which is different from venous insufficiency. Some risk factors and causes, the most common cause being atherosclerosis, or the plaque buildup. But what is that from? Well, there's a variety of risk factors such as smoking, elevated cholesterol, coronary artery disease, diabetes, and obesity. I'm going to use my father as an example. He was a cigarette smoker. He had high cholesterol, coronary artery disease. He was not obese, and he did not have diabetes. He was a longtime cigarette smoker, about 55 years. So in addition to having end-stage emphysema, he did have very severe peripheral arterial disease, as well as coronary artery disease and basically plaque buildup into his carotid arteries. He had strokes in the past, so what we call a vasculopath, which was a mess. So some of his symptoms in his later years of life were definitely the intermittent claudication. He could not walk very far. He could probably walk from the kitchen into the end of the living room in his later years, even though we're really supposed to teach people to exercise, which tried to do, but yet it's difficult because he has so much pain and couldn't walk very far. But exercise is a really good treatment for this because it does help with circulation, because remember, we're trying to get blood down to our feet as much as possible. So what would happen is when he would walk those distances, he would start getting pain and cramping in his legs. That is intermittent claudication. So that is a sign of peripheral arterial disease. So when he would sit down, he would feel much better. And he had weakness, and the lower extremities were cold, because remember, this oxygenated blood's not able to get down to the feet as efficiently. So you can have cold feet. Also, you can develop sores, which my father did not get, but as you can see in the video that Dr. Woda showed, there's definitely some gangrene ulcers that can form. Also, a weak or no pulse. Now, if they have no pulse, that's very alarming, because what's going on? They can get some complications up here, such as gangrene, ischemia. We talked about the sores, and ultimately what happens, you end up losing toes, feet, etc. There's other treatment, which I want you to go back and see the video if you can't remember, but remember all the medications, including the Plavix and the aspirin, to keep that blood flowing. Also doing balloon angioplasties, taking out the plaque also, and doing bypass surgery with a graft. So with my father, he ended up passing away before he ended up with complications from PAD. He had an ischemic bowel. But as you can see, that all of these risk factors are very important, and usually you have a combination of risk factors. So what do you want to do with these people? You want to tell them to exercise. They're most likely on medications. No smoking. So my father ended up quitting smoking 4 years before he passed away. Statin medication for their cholesterol, but also tell them to have a low-fat, low-cholesterol diet. So let's move on to venous insufficiency, which is different. This is a valve problem, meaning, remember I showed you the picture here, the veins have to carry the blood back up to the heart. And there's valves. So I drew a picture up here of just a tiny vein with valves. And remember, this is a gravity issue most of the time, where the blood is not able to get back up to the heart as efficiently because these valves don't work very well, or they took a long car trip or been sedentary for a long time and end up pooling and causing a blood clot. Also, varicose veins can develop. Oops, I wrote that twice. Obesity, and as we get older, you're more at risk. So symptoms include swelling of the lower extremity, sores, which Dr. Woda showed the difference of some sores on her video, as well as pain. It's different than intermittent claudication. So these people are sitting down and they have pain. And skin changes. If you have chronic edema and swelling, think about your leg being blown up like a balloon, and over time the skin color changes into more of a brown pigmentation, sometimes a reddish, and they just feel tight. I've seen edema so much as that it weeps out fluid, and they're at more risk for, or an increased risk for cellulitis. So how are we going to treat that? Treatment is think gravity, elevate the legs as much as possible, compression stockings to try to get the blood back up to the heart. And let's treat these varicose veins. Some people have vein ligation, which leads us into deep vein thrombosis. So when we think deep vein thrombosis, that's pooling of blood and ends up forming a clot. So what are some causes? I'm just going to put the most common causes, which is being sedentary. So think of long car rides, long airplane rides, or just being sedentary. Obesity, as well as what we just came from, is venous insufficiency. So this is a blood clot in the venous system. It's not an arterial thing, it's a venous system. And I drew a picture of this is actually a picture of legs here. And here's the knees. So I just want to show you where you can have blood clots in the lower extremities and the calf. Although those aren't the ones that are alarming as much as getting blood clots in this bigger system in the femoral vein artery branches. So when people present, they usually have one leg, because you will usually get a blood clot in one leg. It happens above the knee for the most part, but what happens is, remember, let's say there's a blockage or a blood clot right here in that vein system. That blood cannot get back up to the heart, so therefore it pools here and it becomes swollen. So there's some common misconceptions thinking because your leg's swollen here, you have a blood clot here in the calf, when that's not necessarily true. It's usually you have a blood clot up in this area, blood gets backed up in this area, becomes red, painful, swollen, unilateral, and then you do a good history to see if they've had any trips lately. Are they obese to begin with? Do they have other comorbidities also, such as diabetes? So how are you going to treat these people? Well, if it is severe enough, sometimes they will put them on heparin in the hospital. Now with that, you have to monitor the pro time, and the PTT is most often affected with heparin. But for most of the time, most commonly, you will see patients go on Lovenox, which is enoxaparin. This is low molecular weight heparin. Because it starts working right away and starts thinning your blood right away. In the meantime, these patients start warfarin. So you can start the Lovenox injections. These patients do this at home. It's also done in the hospital, but this can be treated as an outpatient. So they take Lovenox, get started on a dose of warfarin, and then in about 3 to 4 days, they go and get their pro-time and INR checked, because if you have a deep vein thrombosis, you want that INR. Remember, you want your blood a little thinner, between 2 and 3 for the INR. So you will stay on the enoxaparin or the Lovenox while you're on the warfarin, and once the INR reaches between 2 and 3, you'll discontinue the Lovenox. and you'll go frequently, especially in the beginning, to have your INRs checked. There are other anticoagulants out there that I'm not going to go into, such as Eliquis and Pradaxa, but these are the most common ones. Warfarin is very inexpensive, and still like I said, the most convenient, not convenient I should say, but the easiest one that's prescribed and most commonly. One other thing to remember is blood clots. These medications are not actually dissolving the blood clots. They're thinning the blood in your venous system so you don't end up getting more blood clots. In the meantime, over time, 3 to 6 months, that clot that's already been developed will end up dissolving or should dissolve on its own. And lastly, we will talk about Raynaud's disease. So Raynaud's disease deals with the fingers and the toes, and it is constriction of the arteries. So I drew a hand here just to show you that the symptoms. So what happens is the arteries, or the small arterioles in the fingers and the toes, end up constricting, therefore turning your hands white and bluish. So they get cold very easily, and they sometimes feel numb. They can have paresthesias or tingling, but it is constriction of the arteries. The causes are really unknown, but about 70% of cases end up having a connective tissue disorder, such as scleroderma. So how do we treat this? Well, there's different ways to treat it, such as trying to do whatever we can to vasodilate or relax the blood flow so blood can flow through easy in the hands and feet. There's not a cure for it, but we do what we can to try to at least eliminate symptoms. There's medications that we can try, such as calcium channel blockers. Those end up relaxing the vessels. It's a vasodilator. But some people just don't like the side effects of that. And if you don't have a hypertension issue, it can lower the blood pressure. No smoking, because as we know, smoking does constrict the arteries. Caffeine is a stimulant also, and we need to work on relaxation. So anything that can affect the blood flow or help the blood flow smoothly to the lower extremities, feet and hands.